for our April partnership meeting. We are live in Fairbanks for those who are online. I'm going to give away. We've got people all over the state, but we're here at Fairbanks Memorial Hospital on our Go Blue Days. We've got lots of blue in the room to celebrate April as a Child Abuse Prevention Month. So today we have lots of amazing presentations from the Fairbanks area, and we've even got some from our statewide partners online. And to kick us off for our official welcome, I'm going to have Dr. Brunner. Welcome.
Hello. Hi, thank you for being here in Fairbanks. Thank you to those of you who traveled to be here. We're excited you're here for our melt. I didn't know if I was ever going to get to say melt because it's been, I think, the longest winter in the history of the universe. Coldest, most snow, all the things. And so we're very excited to see the dirty snow and the trash on the edge of the road. And we're going to pick up soon, so all the snow will be melted. So thank you for being here. Thank you to Foundation Health Partners for sponsoring the room and the food and all the things today to make this possible. I'm excited to learn about kids.
Yeah, awesome. Thank you so much, Dr. Brunner. We're just going to go around and do a quick round of introductions. So we're going to start with Dr. Eisner. Sorry, surprised you're here. And we're just going to go around. If you could say your name, your role, and your agency, and then we'll just go around the table.
Hi, I'm Dr. Eisner. I'm a pediatrician at Chief Andrew Isaac Health Center, and I'm the section lead over there.
I'm Laura Brunner. I'm a pediatrician.
My name is Carmen Manger. I'm the director of programs for the Alaska Pediatric Partnership, and I'm helping with the virtual moderation.
Hi, everyone. Tamar Benyamin. I'm the I am just looking at my notes for announcement.
Hey everyone, I'm Matt Hirschfeld. I'm one of the board members on A2P2. Thanks for having us up.
Hi, I'm Heidi Haas. I'm the Executive Director of Alaska Center for Children and Adults, or ACCA, here in Fairbanks.
My name is Anna Zerfus. I'm a navigator based here in Fairbanks for Stone Student Group. I'm going to sit in for Mary Middleton.
Hi, Brittany. I'm a developmental therapist at ACCA.
Hi, I'm Rachel Evans. I'm an itinerant public health nurse over at. I'm Jenna Hipton. I'm one of the public health nurses also at the Fairbanks Public Health Center.
Hi, I'm Tina Gordon, also a public health nurse with a focus on public health emergency preparedness.
Hello, I'm Joanne Spears, public health nurse for the Public Health Center.
Howdy, I'm Nathaniel Snyder. You can call me Nat, just like the bug. I'm the Family Services Manager over at the Resource Center for Parents and Children, or RCPC.
I'm Bryn Ehlers. I'm one of the pediatricians here at Fairbanks Memorial. Hi, I'm Jerry Rosenblum. I'm the nurse practitioner here.
Eileen Stevenson. I work at Thread as a professional development specialist.
Izzy Adams. I also work at Thread, a statewide child resource central agency, and I'm a services.
My name is Melissa Waite. I'm a physician assistant and I work mostly outpatient pediatrics here in Fairbanks.
I'm Meredith Maple. I'm the director of the Fairbanks Children's Space.
I'm Kat Lindsay. I am a project director at the Stellar.
Trevor Storrs with the Alaska Children's Trust based in Anchorage.
Teresa Roble, I'm Children's Trust Director for Policy Net.
Hi, I'm Caitlin Pfister. I'm the Director of Community Engagement, and speaking of which, if you are free tonight, if you have an event, let me know. At 5:30.
My name is Callan Chadwick-Sifsoff, and I'm on the board of the Alaska Children's Trust, and I was a former Olympic athlete and currently work for the Alaska Coalition on Housing Police.
I'm Julia Martinez, Director of Individual Giving for Alaska Children's Trust, and to tag on to the event, it is tonight, Noyon Center. Many of you might have gotten invitations. Starts at 5:30. We're celebrating our interior champion for kids, Desiree Matz, from who is the program manager at Stevens Place. So she'll be there. So please stop by. 5:30 to 7.
Wow, what a wonderful person to honor. Great. Congratulations to Desiree, and for you guys for highlighting her. Such an incredible champion for all the work. Incredible work. We met her a couple years ago when we did a tour, and we're just in awe of her knowledge and the support that she provides. So wonderful person. Desiree, for getting this, we all appreciate you greatly. Thank you.
Did I unmute ourselves? I just realized that we did this. Oh, good.
Oh my gosh, okay. And I'm Rhiannon McKay. I'm the partnerships lead here at A2P2 and love leading these monthly meetings because we get to highlight and have a community brag for the great things that are happening all across the state. The way you all connect with children, youth, and families and serve them and support them and help them be their best selves and have to be the big voices for their little voices who don't always have the right things to say. So we appreciate all of your big loud voices in the way that you bring care to them and their families. So we're going to kick off with our first with our announcements from our wonderful tour.
Over here. I actually have you.
Yeah,
Thanks. I can only multitask so much. First of all, welcome everyone. We always love Fairbanks's, well, we love all the partnership meetings, but we love coming to Fairbanks and getting to spend time with our board member, Dr. Bruner, and hearing about the amazing things that the community does. You guys have so much going on here, and we've also enjoyed coming quarterly for the pediatric behavioral health meetings and pleased by the progress that's being made in that area as well. We've got a lot going on in the agenda today, so I'll get to it. April is Child Abuse Prevention Month, or could be this. And today is Go Blue Day. So I know all of you with the scrubs totally planned that. But good job. We all, whatever our role is, are playing a part in preventing child abuse in Alaska. And we've got our friends from ACT here, which is also awesome. So thank you for whatever it is that you do to help children in Alaska thrive and be safe. As some of you know, we recently launched a new pilot program under the umbrella of Help Me Grow Alaska. The program is called Growing Minds. Growing Minds is a resource for any of you working with children birth through 5, including home visitors, medical providers, social service professionals who don't currently have access to infant and early childhood mental health consultation. It's a non-emergency support service. So you would call Help Me Grow, like the way you would normally call Help Me Grow Alaska, and get routed to our contacted infant and early childhood mental health provider, Tony Ray. And this service is designed to help navigate specific concerns or find new ways to nurture a child's social emotional development, whether it's a specific case that you need consultation on or support on, or just have, a need for some general guidance on your practice. So we're really excited to have that pilot launched and operating. Alaska Home Visitor Alliance Annual Summit is coming up. Do you want to talk about that?
Sure. Yeah. So our annual summit, we have a really cool networking group for all Alaska's home visitors from all the models. And every year we host an annual virtual summit filled with amazing presenters. So we've got a couple keynotes. We have a morning and afternoon keynote. One of our morning keynote is led by Dr. Kevin Gruber from Love Dad. He's going to be giving a training on fatherhood engagement and what male caregivers look like and how to involve all of them into the family life of the child. Then we have Angela Rao, who's going to be giving a session on the neuroscience of change. So how to manage change and how your brain shifts when you have resiliency and hope and support around that. And then we've got some great breakout rooms that include some information on the intro to the pyramid model. We have Dr. Kyle McCown talking about pediatric constipation, which is super exciting because if you're a parent or working in the lives of children, you know that this is a big thing to deal with. And so it's an exciting presentation. I laughed to start there all the slides and learned already a lot. So, and then we've got a presentation on perinatal mental health, which is also very exciting. So we've got some really great sessions. It's free to register, and Aggie is going to put that into the chat. And then for those of you in the room, you can either email me or go onto our website to register for that.
Thank you. I just realized I was hiding from the camera over there, not on purpose. We had a constipation talk at the symposium in November, and it was awesome. So,
Like glowing, I'm sure.
Right?
We're hiring. A2P2 is growing to meet the need for, the growth in demand for helping grow Alaska services, growing minds, and also just in general, the role that we serve in Alaska, supporting children to, reach their full potential, supporting their families to raise them to reach their full potential. So we have, several different roles that are posted on our website. If you know someone who's passionate about the work that we do and making a difference in Alaska and the systems of care, then encourage them to apply. We would love to help getting the word spread to others. So take a look, and we have our newsletters. It's posted on the newsletters as well. And then we have two great events that are happening. So today, RCPC's 4th annual Go Blue Day open house, and it's happening now through 4 o'clock. So you can have your lunch here and your meeting, and then head right over there in your blue clothes. You get to tour the facility and browse the resource tables and network, and other refreshments provided, most in case you're not here. And then on Thursday, so as part of Thread's 40th anniversary, they have several events happening. On Thursday, April 9th, they will be celebrating with a meal from 4 to 7. Is it also food trucks, I think?
It depends on the community, yeah.
In Anchorage, there's a food truck event. In Fairbanks, why don't you talk about it?
Our diggity dog will be with our protein lunch out of that. Yeah.
All right.
Enjoy a free meal and celebrate with us.
Sounds good. And Juneau also, it looks like Juneau also has an event with a free meal. So come by and check it out, and congratulations to Fred on 40 years of a lot of hard work on behalf of child care in Alaska.
Great, Ani, thank you. Yes, lots of stuff to celebrate all across. I wanted to give a big highlight and shout out to 3 people who are here: Heidi, Tracy, and Meredith. They are our local representatives on the Early Childhood Network, which is a group of early childhood advocates from across the state, and they represent Fairbanks so well. They hear what's happening in their community, and they have such a big mind and advocate heart to feel like, how can we support the people who are doing all the hard work? How can we make them feel included? How can we learn more to help our community better? So thank you, each of you, for the time, the energy, and everything we give to the Early Childhood Network on behalf of them. So with that, Dr. Bruner, we're going to kick off our first presentation.
Okay. Well, thank you guys for being here today. I can't stand in front of a room full of people and talk about kids without taking a minute to say how grateful I am for each and every one of you. That this has been a year. This has been a year in the pediatric space in terms of families sharing stories, sharing struggles, sharing worries and concerns. And I know that in my world and in the spaces that I see, what that does to each of us. You take those stories home, you take those feelings home, you internalize that process, and I really am grateful that you are here today. And everyone in this room, I have no doubt, and the people online that I cannot see, work hard to make the world a better place for children. And it really gives me energy to be in this time and space with each of you. So thank you for that. With that, I talk fast and I'm sorry. I will try to pause and breathe every now and then. I'm going to talk a little bit about Foundation Health Partners. Quick outline, we're going to talk about a bunch of different things. For most of you that are here in Fairbanks, Foundation Health Partners is a nonprofit community-owned entity that owns the hospital and then the associated clinics and spaces. And in January of 2018, we became a completely owned and operated nonprofit here. So I have the privilege of working in a space where I work in a community-owned foundation. And not associated with people making decisions from the outside, which is pretty cool and amazing in this time and space. So I'm very grateful for that. And longstanding member of the All-Alaska Pediatric Partnership, and our executive leadership team is not here right now because they're in another meeting, but they were like, we've been doing this for a long time. Yes, we have. What do we have from a services standpoint here in Fairbanks? So a quick update, Fairbanks Memorial Hospital has about 1,100 deliveries a year here in our hospital, which when I talk to colleagues from other places, they're like, that's not that many. And I'm like, that's the 3rd highest in the state of Alaska. Thank you very much. Bassett Army Hospital does have a high delivery volume as well for Alaska, between 350 and 450. Some of that depends on deployment. Thank you to those of you who have worked at Bassett and are married to military spouses in the room. I do. We do have a level 2 NICU here at Fairbanks Memorial Hospital, so that is the only NICU outside of the Anchorage area. We do have in-house pediatric hospitalists. Those would be your ladies in blue today over here. And then big exciting news from last year, we are in the process of developing an OB hospitalist program. So those of you that don't live and breathe in the clinical space, a hospitalist means a doctor who is at the hospital. I couldn't come up with a fancier word, so that's the word that we have. That means that you are in the building taking care of the patients in the hospital. So what an OB hospitalist program will mean is that our goal is to have an obstetrician in the building all the time. So if there's an obstetrical emergency, that we have someone immediately available to help. We're not quite there yet, but we're working on it, and that is very big and exciting for those of us that live in the pediatric space, which receive the work of the OB hospitalists. Inpatient facilities, so I would be remiss, my nursing leaders are not here, so I can talk about them while they're not here. I would be remiss to not call out the amazing work that they do every day, and how privileged I feel to be in a state that has dedicated pediatric nurses. So they are fantastic and amazing and know so many things that I do not know how to do, and I'm very grateful for them. So we do have an inpatient pediatric unit. We do have a NICU, we do have Well Baby, and this right here is our nursing leadership from NICU and Well Baby. Rachel John just received the Nurse Leader Award for our facility. That's what this picture is here. So her picture's in the elevator too, and it makes her crazy. So if you see her, make sure you tell her you saw me. We have worked hard. There's been a lot of focus nationwide and in the state about emergency medical preparedness for children. So in the emergency department, making sure we have the right training and equipment and tools to take care of kids. And so we worked hard in that space. We have committee reviews, visiting pediatric clinic we'll talk about a little bit. I'm going to focus on behavioral health for a minute, and then statewide collaboration with other hospitals. So what that means is I call Matt and I'm like, oh, hey, Dr. Hirschfield, quick question. What are you guys doing with this? So appreciate all of you taking my phone calls and our team's phone calls to help learn from each other. And then what we're also excited about, if I haven't mentioned it, is nothing. Had to put it from an outpatient standpoint, so those of you that have been in Fairbanks for a long time know we've had a big change in the last couple of years, and that is moving the clinic space out of the Tannerau Valley Clinic building where it's been since I was a kid, over here onto the hospital campus. So our pediatric clinic is now on the hospital campus. It's 3 floors straight above us right here. The important thing for you to remember if a family is asking is, how do you get in? If you say the south entrance, no one in Fairbanks knows what direction south is. Where does that face? What's that near? What color's the building? It is at the entrance E for elephant. So you are telling a family how to get here. They come to entrance E for elephant for the pediatric clinic now. And then I think when I talked with our outpatient pediatric providers about what the last year has been like, they gave me all the celebrations that we talked about. What have been the stressors? The stressors have been just kind of that feeling that kids are just a little bit more sick. Their families are just a little bit more stressed. No one specific thing, but just more stressors on families and just a little bit sicker kids. Vaccine rates, as you have seen, are changing significantly across the country, and less engagement with preventative care. So I think there's been just a less routine well child checks, less prenatal care, less sort of routine preventative care on average is kind of the feeling. We have a little bit of data to support that was kind of the feeling in talking with providers. Here we've talked about a number of these pieces. I want to highlight the visiting clinic work and say thank you to all of the teams who help make that possible. So what visiting clinic means is we have pediatric subspecialists who get on an airplane sometimes at 5 in the morning to fly here to be able to see our kids in a clinic here. What that means is if they see 15 patients a day, that's 15 families that don't have to travel for that same appointment. They do that because they are kind and good and smart and they care about kids. That means they have to wake up at 3 a.m. to get to the airport, to get on the plane, to get here by 5 a.m. And none of them are lacking for business. And so this is not something that they really are so excited to be able to see more patients. They do this because they know it matters and it matters to our families here in Alaska. These are the groups that we currently have coming. The one I want to highlight as the addition for the last year, we heard earlier in a partnership meeting about the Aspen Pediatric Endocrine Clinic based out of South Central Foundation. That has been life-changing for many of our families, particularly with type 1 diabetes in Fairbanks. And then the second one is a pediatric GI clinic from Alaska Pediatric Specialties This is just started in January. Can you tell I'm excited about it? So they are seeing patients here in clinic and they, Dr. Melandra did his first day of endoscopies and colonoscopies for children here in Fairbanks too. So if you think about doing, speaking of constipation, a bowel prep for a child in a hotel out of town, a whole lot nicer to do it in your home. I'm going to shift gears for a minute and talk about the behavioral health work. So many of you have been involved with the behavioral health summits that Foundation Health Partners, Greater Fairbanks Community Hospital Foundation have been hosting for the last 3 years. This is typically a quarterly meeting, and it's really meant to be the leaders of many organizations. Again, many of you guys have been there in the room talking about how do we make things better for kids in the behavioral health space. The celebrations I'm going to talk about is there's now a partial hospitalization program at Alaska Behavioral Health in Fairbanks. That means adolescents who need help can get the help they need here in town. And their wait time to get kids in is usually between 1 and 3 days. What? I mean, you can say things like 1 and 3 months. 1 and 3 days. That means if you have a behavioral health crisis and need support to stabilize it, we can actually get you that support in a timely fashion, just like we would a stent for a heart attack or thrombolytics for a stroke or those sorts of things. They also just announced they're starting evidence-based eating disorder treatment, both in Anchorage and in Fairbanks at Alaska Behavioral Health. That's not something that we've had in the state of Alaska. This is huge. I'm excited. A day treatment program at Fairbanks Native Association that has had kids graduate from that program. GRAF has opened Tanner Keith's conference, and that is very exciting. Family Centered Services of Alaska has expanded capacity, and then North Star has been involved in this work because it's the inpatient location or the primary inpatient location, particularly for young children. And they've done a lot of work looking at their length of stay, looking at their evidence-based treatment models, those sorts of things. So it's been nice to see that work happen. Okay, our adolescent behavioral health unit, which is the question I get the most often. So a few years ago, Foundation Health Partners identified this need and started working towards building an adolescent behavioral health unit here in Fairbanks as part of our hospital. And the idea behind that is we are a hospital, we are good at being a hospital. We need all those other things, right? Day treatment, partial hospitalization, outpatient support to do those things so that kids can get the level of care that they need in the space that they need. This is the part that we can do. We can't do all those other pieces because we don't know how, and there's other people who are already really good. Where we are now, the exciting thing is our certificate of need was approved, which any of you who've been through legislative testifying and state testifying, those sorts of things know that that is a hoop to jump through. And so our certificate of need was approved just recently. And then we're recently just awarded a significant amount of federal funding designated through Senator Murkowski's office to help support this work. So what that, I know, what that means is now we get to start the construction process. So we did a whole bunch of construction bids and work, and then it took a couple years to get through these few hoops. Construction has not gotten cheaper in the last 2 to 3 years. And so we are now restarting that construction bids and process and contracting piece of it. And then same thing, I keep calling all of you and saying, what are you doing? How can I learn from it? What have you learned? How can I take what you've done and implement it over here? And so we're in the programming phases of that. This is just meant to say we are doing construction. We are not building a new building. We are building a space onto existing space. And so our adult inpatient behavioral health unit is upstairs on the 4th floor. This will be on the back side of that. So we are doing construction in an existing patient care space. It's a very high risk construction patient care space. So it will cost much more and take much longer than you would think that it would. This is the current layout of that space. Here's what we're going to do to that space. And here's how fast we're going to do it. So it's going to take a minute when we get there. Everybody's big question is, what day are you going to open and start taking patients? And I'm not going to answer that question because I'm going to get it wrong with whatever I say. But our hope is to be able to be working through the construction process through this summer and hopefully have final timelines this fall. This is where we get to do the cool fun stuff. So we get to look at what are the spaces and places and how do we make them healing and calming and supportive for families. And so just starting down some of these journeys. And then we got to try out some different things. So we got to try out how do we move patients, and we have some patients who are not mobile. We didn't know how we could do that. Look who the patient is, guys. It's me. This week, trying to figure these things out. So we do get to work through some of these processes here. And then I just want to pause here at the end and say, all of this work takes a village. It's so fun to hear every single one of you talk about the places you are, the work that you do as you're introducing yourself, because I'm like, oh, hey, Brandy, what's up? Haven't seen you in a hot minute, right? Our families move back and forth between all of these support systems in our community all the time, and we all rely on each other so much. And so I just want to have a huge moment of thank you that I know many of our nonprofits in our community have had a rough year funding wise, a rough year need wise. When I think about the door, which is our shelter is how it's classified for children in our community, they've kind of really, been through some crisis moments this year. And I'm so appreciative of the work that they do and how they help support our kids. When I think about the Children's Museum, oh my gosh, so exciting, right? We're gonna hear more about that. I won't steal your thunder. Work with United Way, the Boys and Girls Club here, closing acutely, shifted that need. Those kids and those families' needs didn't go away just because the doors closed. And what keeps me excited and energetic about this work is seeing the way each of you respond to those changes within your entities. WIC and public health, like we got WIC, guys. Remember when we did that WIC? We talked about that for a long time. We got some WIC now. This is great. And then all of the other entities here, what I would ask kind of my pediatric subspecialty care ask is please continue to vocally support in the places and spaces that you are, how important that is for families to have access to care as close to home as possible when we can make it happen. That's what I got. Questions? All right.
Thank you for the time. Just to like hype up the hype girl who just hyped everyone up in this room. Last year, we got delayed in the airport, which, typical Alaska travel. And I actually ran into my son urologist who was here doing clinical and was just so excited because she had just had this amazing meeting with Dr. Bruner. She said, I don't know if you work with this woman, but she's incredible. I love her so much. Every time I leave, I feel so uplifted, even though I'm exhausted. I was like, Dr. Bruner. She's like, I'm talking about Dr. Bruner. And I think she's on our board, and that's just like the way you appreciate and involve and lift everybody up in the circles of care is huge because we're all in this village of community together to support children and families. And so the voices are all like shouting and praising and celebrating together. So thank you for being a leader in that excitement and partnership. With that, we're going to talk about some more exciting partnership from Dr. Reiser.
Right, so I will be giving a brief overview of a pediatric update at Chief Andrew Isaac Health Center. So as many of you may know, our new facility was opened up in 2022 in the fall. We had a cultural board that came together and their goal was to create a space that was not stark and institutionalized. We wanted a place where people felt that their land and their community and their culture was represented. And for anybody that's been in our building, in our facility, I think that comes across. And so it is 203,000 square feet. We have an expanded lab, an urgent care clinic, a surgery center, an optometry clinic, and we also have an infusion center and a cancer care clinic. We have visiting specialty care from ANTHC, and we have the capabilities for x-rays and ultrasounds, but we also have a CT scanner for our urgent care, and then a fiber scan machine, which is very exciting. We offer OMM for pediatric patients as well as adults, and then we have traditional healing with training programs being created. Here's our pediatric clinic staff. So we have myself, Dr. Eliana McKee, who's been with us for about 6 years. PA Stephanie Homan, who's been with us over a decade. Anybody that knows PA Homan, she's just a wealth of knowledge and a great resource. And then nurse practitioner Sarah Reed, she started about the same time I did in 2024. And she's wonderful as well. And so this was our last year for Halloween. We went with a Jurassic Park theme, as you can see. It was quite fun. That's me in the dinosaur suit. I'm a very serious person, and it was great to dictate my patient notes in that. And then our prior year was Under the Sea themed, and then that's my CMA, Casey. She is just laying on the floor, sprawled out as a turtle. So this is the area in which we serve. It is 235,000 square miles of interior Alaska, which is about 37% of the overall state of Alaska. This is just smaller than the state of Texas. So we have 4 pediatric providers covering that area. So our clinic mission at Chief Andrew Isaac, we of course offer well child checks. We have acute visits, and then telehealth appointments are huge, not only for the Fairbanks North Scarborough area, but of course for our villages and our subregions. And then we offer pediatric call. So one of our providers is on call at all times. It's 24/7, 365. And this is for the villages and subregions, also for our urgent care. We respond to other providers at Chief Andrew Isaac, so our family medicine providers and APPs, as well as outside providers like our wonderful colleagues at FMH. And then we go out to the villages. Each care team covers a region of villages. And each of our providers, our 4 providers, are part of a care team. And so we try to maintain continuity as best as possible by going to the same villages. So we really build that rapport. We build those relationships with those families. And some of these villages are pretty small, and so you get to know the entire community pretty quickly. It's beautiful. Okay, so as Dr. Bruner alluded to, it's been a rough year. It just has. And so there's been some political changes that have had a large healthcare impact, especially on our underserved Alaska Native communities. Key policy area changes that negatively impacted health, as you all know, Medicaid, SNAP, and then vaccine information. And so just for some context, the average life expectancy of an Alaska Native individual at birth is about 8 years lower than the US average. There's higher rates of chronic disease in our population, and just over half of American Indians, as well as Alaska Native children, are covered by Medicaid. That's a huge proportion. That really is. And so with the proposed federal cuts of $911 billion over a decade, it's estimated that there will be more than 10 million uninsured people. Medicaid's primary coverage source, a major funding stream for tribal health systems, including IHS. Regarding food insecurity and SNAP disruptions, anybody that's been to a grocery store in Alaska, y'all know that we have some of the highest food costs in the US. Rural households can expect to spend 2 to 3 times more. And then our Alaska Native populations experience higher rates of food insecurity than the national average. Some of the key changes with SNAP, of course, there was the temporary benefit disruption during the federal shutdown, and then there's policy pressure to reduce program funding. For the health impacts, this increased food insecurity, increased reliance on low quality foods, with higher rates of chronic diseases, and of course, this is going to be an extremely stressful time for our families and the community at large. So with vaccine information and some changes and shifts in governmental bodies and NGOs, there's been rising vaccine hesitancy secondary to the misinformation. Some childhood vaccine rates have actually dipped below herd immunity thresholds. So we've seen a resurgence in some vaccine preventable diseases. This has had a huge impact on our Alaska Native communities because the rural access challenges amplify the risk. And then we already are increasingly vulnerable to outbreaks.
Quick question on the vaccines.
Yeah.
I'm curious, it's the Alaskan Native population vaccines dropping at the same level as the non? I'm just curious because the history there, it's much more recent, so I'm just curious.
Yeah, so we are actually I have that at the end of this.
Okay.
Yeah, no, you're good. You're great. So that is something that we're looking at, and we're gathering statistics regarding that. Right now, we are seeing a resurgence in certain things like pertussis. I've been a doctor for almost a decade, and I've never seen pertussis except for in developing countries when I went on missions. And I've seen a lot of that in the last few weeks. And so anecdotally, we're seeing a lot of resurgence. but the data is still forthcoming. And we are making strides too, which is great. And so that being said, the only way out of a difficult situation is to face it head on and go through it. And so does anyone know who this guy is over here? Teddy Roosevelt, yeah. So he has this wonderful quote that I think really embodies our community at large, as well as our Alaska Native population. And that's, I've never in my life envied a human being who led an easy life, but I've envied a great many people who led difficult lives and led them well. And so there's been great resilience and leadership from TCC. There's been a renewed focus on self-governance and unified advocacy against Medicaid cuts and defending tribal exemptions for Medicaid as well as SNAP benefits. We've expanded our telehealth services so that we can reach the more remote villages despite provider shortages. And then we supported sanitation and infrastructure programs, which of course directly impact health outcomes. There's been a great vaccination effort. We deploy community health workers to combat misinformation and increase trust. There's a huge emphasis on shared decision making. And we've increased our staff awareness and education at each of our meetings too. For food insecurity component, we partner with you guys, you know. So I just want to echo Dr. Bruner's sentiment. It really does take a village, and it was a very difficult time with the SNAP disruption, and our community just came together beautifully. And so just want to thank the Fairbanks area because you helped so many of our families. So that being said, okay, let's shift gears. Let's move on to some photos. This is Hooslia. So this is one of the villages that we serve. Here we have PA Holman on the far right picture. She's second from the right. We have her CMA Jenna, CMA Christina, and then Dr. Lessner, who's family medicine provider. We are very fortunate to have her work with us on special projects. She's with us through grant funding. And then this is CalTag here. PA Holman actually rode behind a snow machine in that little sled way in the back in the middle picture. That was her VIP transport from the airport because it was too dangerous to drive, a vehicle. And so you just, you ride by snow machine. And then failing to prepare is preparing to fail. So in the upper left corner, you always take more than what you think you need. So, more immunizations, more supplies, more everything, so that's what all that gear is over there. This is AKP and Tanana. This is Dr. Eliana McKee, her CMA Christina, and then our health aide, Melissa Shavings. Recently during her trip to AKP, she was without internet for a week, and she handled that beautifully. She went old school. There's some paper charting and lots of notes. Oh no, I don't know why the picture on the left didn't show up, but it was beautiful. It was a white eagle. Imagine like a little boat out there and a sunset. It was stunning. That's myself. That's Casey Simons, my CMA, and that's our wonderful nurse, Audrey. And we're just standing in front of the Yukon. Fun story, when we were on our way to Galena, cool thing is we did get to see Denali, but we were waylaid in Ruby for about 3 hours because the fog was so bad in Galena that we couldn't land. It wasn't safe to land with no visibility. And so we hung out in the Ruby airport. Has anyone been in the Ruby airport? Yeah. So for a 3-hour layover, you can walk around Ruby airport about 500 times. You're looking at it in the upper left corner there. We finally got to Galena, and it was awesome. In the airport, it's always nice to see your name with advertisements, and we were very, very busy that week, so that was wonderful. This is Minto, another village that I cover. This is our setup. Casey brought her tent, and we pitched it about like 20 feet away from the clinic, so it was the world's easiest commute to work. And we had a beautiful view of the water there. If you have 20 minutes of free time, you bring your inflatable kayak so you can go out on the water. Or if it's like midnight and the kids are running around, in Minto, and the dogs are barking, you can't sleep, you just kayak. And this is Allakaket, one of the villages that Sarah Reed covers. And those are her CMAs there, and Dr. Postma in the back. one of our family medicine providers. She was without water, running water for the last week in Allakaket, and she just handled it beautifully and did not complain, which is just great. So we have some cool things. So we do have a Epicenter Public Health grant that came through, which awarded TCC with funding for 3 projects. And so the first one was improving our well child check visits for birth to 5 years old. The second was improving and evaluating our hepatitis C screening program. We let our adult colleagues, our family medicine colleagues handle that one. And then another one that's key to PEDS is the continuation and improving upon our HPV vaccine initiative. And so for improving our adherence to the well checks, we have thousands of children that qualify for care at Chief Andrew Isaac and through TCC as a whole. And we want to capture as many of those kiddos as possible. What we see, these are our current well child visits completed by their age. We see that we capture 90% of our newborns, which is just wonderful. And thank you for to our colleagues at FMH, because they let us know, they make sure that they walk out with an appointment in hand, and that's so important. So we have a 90% capture rate, which is great. And then it just kind of drops off, so you can see at 30 months, it's 22%, not ideal. And so we definitely want to address that. Well, child checks matter for individual children. Of course, you want early detection of developmental, behavioral, and medical concerns. You want timely and complete immunizations. You want fewer preventable hospitalizations, and you want to provide that anticipatory guidance to parents. On a community level, it matters. We want to improve access to care, support health equity. We want to make sure we shift utilization from the emergency and the urgent care settings and save that for children who truly need those urgent visits. And we want to reduce communicable diseases and also serve as consistent touch point for social needs services. We find so many areas that families need assistance outside of medical care, outside of if their knee hurts. And so initial steps that we made, we have a robust social media campaign. And there are digital monitors everywhere in Chief Andrew Isaac, and it just blasts our propaganda. So we have all the ages, that they're due, and there's just multiple slides, and you'll see it everywhere when you walk in the building. It's great. And then Dr. Lesner is working on newsletter articles too, that go out pretty frequently to also educate and inform individuals of when children are due for their well child visits. We're expanding scheduling to our family medicine providers. So thousands upon thousands of children are eligible for care. And, we want to ensure that if they're interested in, care with us, that we're able to fit them in a timely manner. And so we're expanding scheduling to family medicine providers and then using their open access slots. And then we're increasing the number of sports physicals that we do and converting sports physical checks to well child checks when we're able. So that being said, some of the family medicine providers haven't seen kids in a few years, and we want to standardize everything, make sure kids are getting the same level of care no matter who they see. And so this looks very overwhelming, because it is. But if you just start from the left and go to the right, you can see what's recommended at each age. And that's really nice for our CMAs, for our nurses, and for our providers to see when does a kid need their head circumference checked up until? When does the mom need the EPDS, etc. And then we're also making patient-facing screening schedules because it's important for parents to know, exactly when their child is due for the anemia and lead screen, when the routine immunizations are, etc. And then lastly, our HPV campaign. So I'm just going to let this graph speak for itself. Can anyone tell where our campaign started? So this goes from 2020 to 2026. So it started in Q2 of 2024. Took a few months for things to get rolling, but then boom, rates went up dramatically. And so we had increased meetings about this, so increased staff education. We made our electronic health record alarm at age 9 years, the earliest age that they can get the HPV vaccine. Because that's the ideal timing for the immunization to work with the kid's immune system. And then we also recommended at back to school clinics, our village and sub-region outreach, just providing families with the awareness of the immunization and the education that they need to make an informed decision for their child. We've sent out patient text messages, that's new. And so just saying, your child is due for a routine immunization, please make an appointment at Chief Isaac Health Center for scheduling. And then also acknowledging staff. So when somebody does a good job, we want to say good job. We work in peds, and so it's all about positive reinforcement, right? And so I'm really proud of myself. I tied PA Holman, who is a champion. She sits on the committee. I tied her for fiscal year 2025. So yeah, if you're watching PA Holman, I'm hoping to beat you this year. All right, and that is it. This is my contact information if you guys need to reach me. This is my daughter Eleanor. On Christmas, it was a little colder than -20. She kept nice and warm while we were snowshoeing because I was gifted a wonderful muskrat hat and mittens for her by one of our Alaskan Native nurses. And so she's been really grateful for that. She loves to be outside and she's not freezing. She's probably the warmest one of us. So. Great. Any questions you have?
One thing, the work that you do a really awesome job. Have you guys dug in, and I'm sure Dr. Bruno will update us because I know she had a meeting yesterday about all these things. But have you guys done any work on breastfeeding rates in the Alaska Native population here at all?
No, but it's on the short list.
Okay.
It's definitely on the short list. Because we know that, ultimately fed is best. But we do want to improve the rates, especially because there was a formula shortage. We do have WIC, and we have within our facility within Chief Andrew Isaac Health Center, which is great. And we have resource advocates who can help with anything from, sorry, I'm on call right now. That's not, we're good. They can help anything, from food insecurity to housing insecurity. And transportation difficulties. And so they have helped out with the food insecurity piece and when the formula shortage happened. But that is definitely on the short list. So I'm glad you asked.
I have a second question. If you want to print off those beautiful propaganda that you made, I would be happy to stick them in all of your patients' little folders.
I would love that. Thank you, James. Anything else, guys?
Thank you.
Thank you all for being here.
We love a photo montage. Those are awesome. I'm so sorry the one from Galena didn't show up because Galena is stunning. So thank you for all the incredible work that you're doing. This is the point of partnership meetings, right? To ask those questions, to share the propaganda, stuff, right? So thank you so much for all of that. Next we have our wonderful friends at Public Health.
Are we allowed to present?
Sure, if you want to, absolutely.
Hi, so my name is Rachel Evans. I'm a itinerant public health nurse.
And my name is Jen Hipton. I'm one of the public health nurses also at the Fairbanks Public Health Center. And we're here to talk about interior immunization rates today and a SWAT project that we worked on all of last year.
So bear with me as I'm pregnant, tracking.
I need you to speak up a little if you're gonna do it from there, because the mic is over there.
So,
in the right space.
So our mission and vision is partnering with Alaskans to protect and improve the health and well-being of communities. Our vision is Alaskans thriving across generations. And so our program priority areas are going to be to reduce vaccine preventable diseases, improve the health of children, prevent and respond to tuberculosis and other infectious diseases, and reduce sexually transmitted infections and support community mental health and well-being.
This is our current adolescent immunization schedule that we follow with the State of Alaska section of public health nursing. There have been a lot of changes, as everyone has talked about, with immunizations in the last year and a half. Our practice and medical directives follow the childhood and adolescent immunization schedule recommended by the American Academy of Pediatrics.
So we're gonna look at the rates here. So I know this graph is kind of small, but historically, Alaska has had the lowest rates just throughout the whole nation. So what we're seeing now is just even lower rates. So in the orange and in the blue, you're gonna see there's a gradual decline from 2019 from the beginning of the graph, and then there's a sharp decline from 2023. So there's in both childhood and kindergarten. So that's the one.
And this data is coming from the Alaska Immunization Program from the state of Alaska epidemiology for the next couple of slides.
So in this, you're gonna see it by region. So we have Anchorage, the Gulf Coast, Matsu, Northern, Southeast, Southwest, Alaska. So pretty much the whole of Alaska. And here circled is going to be the interior. And again, in orange and the blue are going to be the childhood and kindergarten rates. And so the interior has the lowest rates out of everybody in Alaska. That's locally right now.
So here we're looking at completion of the childhood series, and we have highlighted specific interior data. So the top graph is Q2 2024, so ending in June of 2024. The interior rates for completion of the childhood series was at 57%. And then when we jump down to the bottom graph, this is Q4 of 2025, so ending in December. We had dropped down to 48% for completion of our childhood series. With the biggest drops we're seeing in pneumococcal and Haemophilus influenza type B. And then the next slide, we're going to the kindergarten series. So also Q2 2024, we were at 46% for completion of the kindergarten series. And in December of 2025, we had dropped down to 40% for completion. Our biggest drop was in DTaP. It went from 50% to 43%. And we did actually see an increase in MMR. So again, as some of these diseases are coming back, there was that increase from 51 to 62% completion of the MMR series. And then in October of 2025, there was a pertussis release from epidemiology that just said that during the summer and fall of 2024, unvaccinated children were 13 times as likely, were more than 13 times as likely to contract pertussis as those who were up to date on their pertussis immunization. So likely contributing from that DTaP decrease in immunization.
So in 2024, our section as a whole, which is a statewide section, they updated our strategic fiscal our strategic plan for the fiscal year of 2025 through 2028. So at a local level, so just in Fairbanks, we came together and we kind of discussed, like, what do we want to do? What should we focus on to help this goal? So one of the goals we did choose was just to focus on increasing our interior immunization rates, just because we got the worst rates. So what Fairbanks Public Health is doing is actually, as an itinerant nurse, I do travel. So I had actually had the opposite effect where I was bringing back stations to Ruby and I got stuck in Galena. So it's beautiful there though. But we do hold offsite vaccine events. So we're like in kind of the travel free. So we have been going down to Healy. I've been working with the school district and helping them kind of get their flu shots. And in the fall, we are going to have a flu pod again in Healy and help kind of boost their flu vaccines, and because they don't have it provided right now. But currently in the office, we are working with the schools. We're trying to hold some vaccine events at the schools that we're going to the population. And we're in the works talking with the nurses right now. So we're not too sure where we're gonna end up. So we're hoping to be at some of the elementary schools maybe in April or May. And are also working with them throughout the summer to try to hold offsite clinics too. So those are in the works too. And every month we do the North Pole Clinic. It's a part of the local area that is low. So it's just a lot of people can't make it to Fairbanks, can't make it to their appointments to kind of boost those rates. And then We offer late night hours and walk-ins over at Fairbanks Public Health on Tuesday, Wednesdays, and Thursdays. We do immunization records review. We can do flu and COVID for those that are homebound. And then we offer kind of just various community events. We pop in various community events and kind of talk about immunizations. And then there's a project that started in 2024 called the SWOT analysis. So after our strategic plan came out, we started this. So due to the vaccination rates that are being so low, we started in 2024 collecting the data, and then ended about early 2025. We split into two groups. So one was analyzing data after we collected it, and the other was collecting the data. So we did key informant interviews. So we identified key questions and some key stakeholders in our community, and we outreached and narrowed down our interviews for those available. So we ended up doing 8 interviews with the stakeholders in the community after outreaching. So it was kind of depending on availability for those who could do the interviews. And we just had really simple questions. So there's like 6 key questions. So it was like a very quick interview, and then you can kind of add on like anything that you thought might be pertinent to any of our questions.
So from that SWOT analysis, these are the strengths and weaknesses that kind of came up with our community partners in these interviews. For the first strength, policy requirements drive uptake. So we see that childcare and school requirements are really big motivators for parents to stay up to date on vaccine rates. Digital tools are making it easier. So the state developed docket in late 2022, which we have seen a lot of the community partners say it's really nice when parents come in and they don't have those backtrack records for them to just download docket, and then they have access right there to see what their kids need for getting into childcare, going to school. We see high compliance among certain populations, so especially military families in particular are consistently up to date with immunizations, but that's also a weakness later on. Another strength, health department partnerships and flexibility. So we've changed a lot of our hours, as Rachel was just saying. We've created those late night hours, we have walk-in, anything that we can do to try and decrease those barriers so that families can get in, get their kids up to date, and make it easier for them. Strong staff engagement. A lot of the partners we spoke with were actively supporting parents by checking records, by using those tools to make sure that families knew if they were not up to date on vaccines, being able to notify them of upcoming needs, and encouraging the use of some of those tools like docket for those families for easier access. Some of the weaknesses that came from these interviews, flu and COVID-19 vaccines are not typically on a lot of those things that parents are receiving as like a required vaccine. So they're just not really on parents' radar from a lot of the places that we talked to. They were not reminded about COVID and flu vaccines, so they fell off their radar. Technical and system barriers. So this is what we're talking about between federal and state immunization systems can cause confusion. So like what the military uses for vaccines versus what we use. If they come into the public health center and get one vaccine, it creates that artificial lower rate by looking like they're not up to date. Varied immunization requirements. We found that there are just different requirements from different organizations that can lead to that reduction in compliance. So we follow the AAP recommended schedule versus the school district has different requirements to attend school. So that can cause confusion for parents. Negative experiences for staff. Enforcing vaccine requirements can put staff in conflict with parents. It's a difficult vaccine conversation sometimes, and it can be hard to have those conversations with parents, especially as just the environment is changing surrounding that. It's hard for us to have those conversations. So especially for staff that aren't used to having those conversations, just trying to provide them with tools to make that conversation easier. Yeah.
I was just curious, why would the school district have a different schedule than what would be recommended, whether it was the CDC or through a source, do we know why? And is that something that as a group we could get changed?
Good question. So I think the idea behind school vaccine requirements is around transmittable diseases in the school space. So the school is looking at it through a lens of requiring vaccines that I could sneeze on my neighbor in the first grade sitting next to me. The AAP and the CDC are looking at it through what would be promoting your individual health as well as public health. And so the school required vaccines are typically the ones that you can transmit by sneezing on your neighbor. Whereas like HPV is not a school required vaccine, that is typically thought to be more for your individual health. Each school district and school board gets to think about that themselves. So what is Fairbanks North Scarborough School District might be different than Anchorage School District, might be different than school district.
So it is based on the needs assessment. So a lot of times I'll get kids from, like Colorado, like so in their school district, they require them to have meningococcal. And so they'll come up here and they're like, oh, I already have that. But then up here we require hepatitis A. And it's based off of, I think we had hepatitis A.
Yeah, we had higher rates of hepatitis A in Alaska, so we require that with some other states. So is there opportunity to change? Always, but it's gonna be a local government, school board.
We're still only a school board member in the room. Thank you, I was just curious, because it's like, to me, it would be something so easy.
And I think that's why it's confusing for parents and families.
Yeah.
There was a comment in the chat that all districts statewide have the same requirements.
There we go.
And does that person know, is that because the state determines it, or the school districts have chose to follow the same?
The state.
But the compulsory waiting period differs. So my memory from this is that, so it's not necessarily the school requirements are a recommendation, the same way that a recommendation comes from a medical provider that you'd be seeking care from. It's the requirement to attend in person. So they're not making a health recommendation, it's a compliance or regulatory component to be in that space, like Dr. Brunner was saying. And so there's state regs that have the requirements, but then how it's implemented at the district level, it sounds like around the waiting period, like if you move into the district and how long you're able to access it.
I think, I'm sure in your guys' experience, it prompts a lot of questions. There's a lot of, well, why this one and not this one, and why this one? Because I could sneeze something on this neighbor with it. There's lots of pieces in there that I think opens a lot of questions. So I think that's why it's confusing.
Yeah, thank you.
And then our last weakness is access barriers for low income families, things like transportation, not flexible clinic hours, getting time off of work to bring your kids in to get them up to date can be challenging. So decreasing those barriers.
So some opportunities that we found is just normalize vaccinations through peer stories. So we could use trusted community voices sharing positive vaccine experiences, which can help, counteract misinformation and increase trust. Definitely enhance the use of reminder systems. So making sure you're doing those reminder calls. If you have a pediatric client, like sending a little note of you're due for, your kindergarten series, or you're due for your well child. And then often you can promote docket or similar apps to so families can stay current and they can have their vaccination scheduled on their phone. And improve messaging. So emphasize vaccine safety, community protection, and clarify that vaccines like DTaP still need boosters for those. Some threats, of course, there's always going to be misinformation and vaccine myths. So there's very persistent beliefs and disproven theories such as like hospital claims. They continue to decision and drive exemption use. There's a distrust in government and medicine, both historical and cultural, and recently, especially after COVID. So we are seeing like increased use of exemptions, especially religious exemptions for those who are not doing it as or like belief, but as a workaround for convenience and control. And then complacency due to success. So if you don't see polio, you get a polio shot, so a lot of, I want that shot is not here. And then of course, there's just multiple priorities. So we live in a very busy environment, there's working, there's schools, there's childcare, there's other health clinics, there's other information going around. So a lot of times you don't have a lot of time to be focused on what your vaccinations are.
So the recommendations that came from doing our SWOT analysis was number one, to launch a Trusted Community Voices campaign. We are currently working with the Alaska Immunization Program, who had some grant funding around communication and trusted recommendations. And so we're working with them with what we could use that money specifically for, what would be the best campaign to help increase vaccination rates around the state, but specific to the interior with how low our rates are. A multi-layered campaign with the state, but also what partners can we work with? How can we come together? What would be the most effective vaccine and campaign to do here in the interior to help increase those rates? So we're open to suggestions as we are in the process of doing this right now. Number two, bringing vaccines to the community, not the other way around. So as Rachel had talked about, we're really trying to outreach the school district. Where can we go? Where's the place that we need to be that has the lowest rates right now? How can we meet you where you're at? And how can we decrease those barriers for the families that are really having a hard time to take time off work, or just help reduce those barriers for those families? Number three, equipping schools and childcare staff with vaccine communication tools, which is also layered in with one, working with the Alaska Immunization Program on what tools would be effective to help people have these conversations around vaccines at such a hard time when it's really hard to have these conversations. So again, we're open to any suggestions if people and partners have any suggestions on moving forward. It's kind of where we're at with that SWOT analysis. And then these are our current hours, and does anyone have any questions?
Thank you so much. The data pieces, the impacts of all of this is huge, and being able to see it on the screen and even have some discussion here is super important. So lots of follow-up. Oh yeah, Trevor, go ahead.
Just a question, I feel agree. It's not if, I just have a feeling it's going to be when, like a measles outbreak happens. Have you all, like, I know we have a state plan, but has that been revisited? Okay, like, every time I read something or like, oh, somebody's been found, I'm just like waiting for the mass outbreak, and I'm assuming you're all prepped. Is that
Yeah, we actually sat down within the Sector of Public Health Nursing last year after we started some cases here. And we have written an entire outbreak preparedness and response plan. And last May, we exercised that plan, and we're gonna exercise it again in June. So we do have a plan.
And what can our role be? Because obviously, like, one, we try to communicate about vaccines, but if an outbreak happens, how will you be utilizing us as partners to let people know what they need to do and so forth, that we're not like seeing it and then trying to chase you for the info? Is there a mechanism within that plan that we also launch out to all the partners so we can take your information and just blast, like people are seeing it 20 times, not just twice?
Yeah, and part of, I mean, we're a statewide section, and so that communicating with partners really has to take place at the local level. But at the Fairbanks Public Health Center, we have also developed our local plan, and we have a list of all the partners that we'll reach out to when.
Yeah.
Yeah, they needed Trevor. Yeah. Because I think there's the statewide response, there's the public health response, there's also the first case that's gonna walk in, in Fairbanks to one of our spaces. And the timelines for response are going to need to be quick. When you look at that immunization rate, we are at very high risk for very significant disease and a very large population being affected.
I just noticed, like, on the state level at times, always try to remind our state partner that you got something, I find out about 3 weeks later, I'm like, why didn't you let us know, like, we could have put this out there. Like, we all have, like, I think of A2P2's list and our list, and the worst thing is if somebody gets the same email 5 times about a disaster that's going on. And let's remember, sometimes they actually read the 5th one, didn't have time for the 4th, the other 4, so. I wanna be that, get within 24 hours that we have the information, can get it out, and. Of course, as soon as we're alerted, I'm hunting, trying to find where we are, but I just always put it out there, because the partnership sometimes is forgotten.
Yeah.
The
Important
communication
information to
can travel
share.
really fast for that sharing, so
Yeah.
I would like to put that plug in, thank you.
Yeah, no, thank you,
Appreciate it.
Trevor, that's
I
great.
have a tangential.
Yeah, go ahead.
Not really relevant, I'm brand new, I'm just listening, but I work for the Alaska Coalition for Housing and Homelessness, and I didn't realize that pediatrics extends to age 26 until today. And I was just curious if you experience like youth that are closer to 26 at the public health center, or if that's not really a pediatrics phenomenon.
Are you asking about immunizations or services?
Just generally about pediatrics and like the age bracket above 18 that still qualifies, if that's a mix.
So we can see any age at the public health center.
Yeah.
And we definitely focus on youth and getting them.
I think part of that, so the 18 to 26, because like Help Me Grow Alaska serves prenatal to 26, it's not necessarily that 26 is still considered pediatrics, but for a lot of families, they might have children who are not able to, care for themselves. So a lot of it is in capturing those transition periods, children, and also just that random age that insurance kicks in for children. So right, like looking through those areas where transitioning between these like milestones in life to adulthood, whether a person is able to care for themselves or still under their parents' care.
No, sorry for that miscommunication.
No,
Good question, so that in like public health, we love our public health champions, and all of your incredible work, you guys are always in the communities, you all in the North Star Borough are going to visit everybody, and just the incredible work you all do, so thank you so very much for that. I'm just looking at the time, we're getting close to 1:30, so if you need to leave a little bit, you're more than welcome to, but we've got a couple more presentations from North Star, ACCA, and then also from the Fairbanks Children's Museum. So we're gonna still hang in here, but if you have to take off, I totally understand. So Amanda Johnson is the Director of Business Development, and she is online from North Star. So hi, Amanda.
Hey everybody, thanks so much for letting me get on here and do a quick overview. I can do this in like 60 seconds, so I don't have nearly as beautiful of an update as the other presenters do. I just wanted to do a quick overview in case some of you don't know what we do here. And I'm going to focus on the child and adolescent service lines that we have. So we are based in Anchorage. And we have a couple of different services. The main one that probably most folks know about is our acute stabilization. So that is our main building with 74 beds in it for children and youth ages 4 up to 18. And we're doing acute stabilization for those kids. So it's kids who are coming in and we're really concerned about whether or not they're going to be with us tomorrow if they don't receive some kind of intervention. If you want to go to the next slide. We also have residential services, so we have 2 separate buildings for that, one for residential girls, 12 to 18. We have 20 beds for that service. That is typically full. We I've been with North Star for just over a year, and I think we've had a wait list the entire time I've been here, so it's a very much a needed service. And they stay with us a little bit longer, 6 to 12 months, and that's for girls that just need a little bit more help than, stabilization for 10 to 20 days in our acute facility, and they can go back home. These are kids who need some kind of more of a steadying hand and a skill building program for a couple of months. So that's what they do there. And then the Summit is a residential program for boys 11 to 18. They have a little bit more of a wilderness component to their programming. So they get to do some of the cool stuff and go out and do winter camping and snowboarding and hiking and stuff like that. And right now, I think we're running a census of 13 out of 20 beds. So a little bit more room for boys. That's it on residential, if you don't mind going to the next one. Who qualifies for acute services? So it's anyone, like I said before, who's struggling with mental health concerns, and whether it's a parent, guardian, another adult, or a friend who's is just really concerned about if they don't go somewhere official for help, something bad is going to happen. We look at the last 72 hours as far as admission criteria. So if there's something that happened in the last 3 days that's self-harming behavior, they're at high risk. So they're talking about doing something they haven't yet, but you're really concerned that they're getting close to that line, or if they're harming someone else. That's what qualifies them for service with us. And I know a lot of times for the Fairbanks area, they end up at your hospital first. So they're going to be in Fairbanks Memorial and going through your crisis team there. And a lot of times we'll see referrals, and our intake team will help with getting transportation figured out and getting them transferred over to our facility. So. And then residential services, again, is just a lower level of care. So we do have kids that transition from our acute facility to residential. It's not the majority. I would say the majority of our kids stay with us for the acute stabilization, and then we refer them back to their outpatient providers. A lot of times, obviously, if we have kids coming from Fairbanks, they want to go to one of your local residential programs. And so we will work with the families, OCS, whoever's involved, to make sure that they can get back to their local communities for that. And then those who are discharging from the acute level of care, again, but aren't ready to go home, will end up in our residentials. So super easy to refer. There's no wrong door. We don't require a referral from a medical provider or an outpatient mental health provider. If someone's in the community and they want to call and see if their child qualifies for services, they can do that. For people who don't live in the Anchorage area, we do offer phone assessments, so you don't have to fly or drive or anything like that to come here for an assessment. We'll do it over the phone. And then if they do qualify, then we'll help them get here. We operate like an ER. We are considered a psychiatric ER, so we are available 24/7 for those services. If somebody calls during 7 a.m. to 11 p.m., they'll immediately get somebody from the intake department. If they call between 11 p.m. and 7 a.m., then whoever's answering the phone from our night staff will call an intake assessor. They're on call at that point, so they'll call someone to get on the phone and help you guys out. And then there's the fax number too. So short and sweet. I mean, we've been around for forever, so I imagine most of you have had some kind of overview of what happens here. And I appreciate the mention earlier from the Pediatric Mental Health Summit, where we have really worked hard to get our acute length of stay down. I don't know historically if you guys remember what it used to be like here, but there used to be kids that stayed in our acute unit for 30 plus days, and the national average is 7 to 10 for acute stabilization. So the team here the last couple of years has worked really diligently on the clinical product, and we've gotten that average length of stay down to closer to like 20-ish days. So it's still a little bit higher, and there's some elements that play into that are unique to Alaska compared to other states, but we're still really proud of the fact that we're moving that dial back down to where it probably should be based on what everyone else is able to care, the length of care that's happening in the rest of the nation. So the only other update I have is, I don't know, some of you have met our CEO, Jamie Eggert. She actually transitioned to a new position, so she is no longer with us. And so we're working with an interim, and we'll have an update hopefully soon on who the new CEO at North Star is going to be.
Thank you so much, Amanda.
Yeah.
It's been so fun. We've been just having a lot of meetings with North Star lately. It's been so fun to get to know their team and their staff and see the services. And we run into each other now at different events. We're like, oh, hey, we're all in the same circle. And so the positive energy that they're bringing and intentional work to support the children and youth and their families is really amazing. Do you have a question? Yes, go ahead.
Lots of questions all the time. If you were able to give me I know you guys have been doing amazing work in rechanging the program and hearing about all that. If I were to get a 30-second pitch that I could give to a family about all the amazing work that you're doing, would you have one that you could give us?
I'm sorry, I couldn't hear the question.
Sorry, that's okay. But she asked for if you had a 30-second pitch that you could send or give to everybody for them to be able to share with families about North Star and the amazing changes you all have made over the last couple of years. Do you have one of those prepared that you could maybe send out or give?
Yeah, so we're actually working on a video right now. So, and it's high level overview of like right when you call, the referral process, what it looks like when you hit the unit, what programming looks like and all of that. But I can certainly send you some 30-second pitch too. We do have that as well.
Perfect. I'll get your card after this, forward it too. Excellent. Thank you so much, Amanda. With
Thank you.
that, our sweet Heidi Haas. Neighbors to the
Public Health Center.
Yay!
Those that don't know where ACCA is, because that's our goal. And here's our awesome team. So I'm gonna try and be really quick and just highlight, I don't know what I'm doing, okay. Highlight, but this is, this team I'm so incredibly proud of. I want to shout out Brittany came today. We might have some people online, but I'm incredibly proud of this team. We have gone through a lot of changes over the last couple of years, and everyone has stepped up and stepped in. And this is a picture of us celebrating our reaccreditation, which we did in December. So we became initially accredited in 2017, but this year we had an additional program to accredit, and so we took a minute to celebrate. So our mission, all Alaskans are able to reach their full potential, and we do this through our work of improving the lives of individuals experiencing developmental disabilities and delays and mental health needs, regardless of income throughout their lifespan. Our values are really focused around compassion, respect, relationships, quality, and inclusion. And what's really cool about this is that it is entrenched in our system. Everything we do really revolves around this work. Like Dr. Our pediatrician over here, sorry, I always say your name wrong, and then like Iser, yes, I want to add extra letters to that, but I see your name all the time. We have a huge region as well, and so we serve about the size of the state of Texas, and that's a list of all of our providers, but our different services. We actually now have a reach in these areas that we weren't reaching in. We now have a reach in, but it's not always through direct service. It's more about collaboration and connection. So our main programs that we have at ACCA, we have our Child and Family Wellness Program, which is a culmination of many sleepless nights of trying to figure out how to meet the needs in Fairbanks. So we took our work within the FASD diagnostic team, which is something that we've been known for over 20 years, almost 30 years in the interior and North Slope. We're combining that with our infant early childhood mental health experience, which is also very important to our organization. And we've added clinical mental health services. And the last time I was at a behavioral summit meeting, we were going through the process. We are actually, we made it through the process, and we are now a licensed Medicaid provider for youth mental health services. We already have a wait list. That is the downside of the services that we have, but really excited. Hopefully we'll be able to add another clinician, work through our processes, really start building that capacity. But in addition to that clinical work, we also are really working hard to infuse the infant early childhood mental health services and helping families understand the importance of those relationships and the things that they're doing with their kiddos that are lifelong building blocks for development. We also have the Developmental Disabilities Resource Connection. It's a mouthful, DDRC. Our main purpose within the DDRC isn't just to help connect Alaskans that need a higher level of care through waiver services to those services with the state of Alaska, but we want to be that connection for anyone who needs support, resources, referral. How do I get to? Who do I call? What do I do? And so our staff in that department is really focusing on how do we get to all of those pieces? How do we connect everyone? If the only call you can make is, I don't know what to do, but I'm going to call ACCA, we're okay with that. And we're going to help you get to where you need to go. That's our mission. Our infant learning program, which is our longest standing program that we're known for, especially in the pediatric space. We work with almost everyone in this room through that space, serving children birth to 3. Really, if you don't know what that is, it's special education services for our infants and toddlers who may have developmental delays or disabilities. I'm going to take a brief moment. I hope it's okay. Okay. Yes. To also highlight the work that we are doing across the state. So Infant Learning Program serves every single
on that Alaska map, every single square mile of the state through 15 grantees. There are only 15 of us. And we serve children right now. We are only able to serve them if they have a 50% or greater delay. So for those that are maybe not tracking developmental delay, the easiest way to think about it is you have a 2-year-old who is really developmentally showing as a 1-year-old. And that's a very significant delay in a child's first few years. There is a group of us through the ILP network that if you are so inclined, we would take your support as well. We have 2 bills going through the legislature right now. Senate Bill 178 and House Bill 376 are making their way, which would allow us to start serving children to a 25% delay. Super exciting, a little bit terrifying because we know that there are a lot of kiddos out there that are going to need those services, but we have a really solid plan that's been in the works for about 4 years on how to do that and how to do it appropriately and effectively and efficiently. The infant learning program, unlike many other programs in the state, has had flat funding for more than 10 years. So we're still seeing the same number of kids that we've always been seeing, and we can do it on a really tight dollar, and we're super good at like reusing paper clips. That's the example I always use. We're super good at providing services. And so we are really passionate about getting this bill moved so that we can support more kids. And in the long run, the impact for our communities, our state, is a savings in special education costs. If we can help kiddos in the first 3 years of their life where 90% of their brain development happens, then we think we can really impact that on a statewide level to support kiddos long-term. Our infant learning program it's 100% voluntary. All of our programs are 100% voluntary. We do not do any required work. So parents are number one caregivers, number one teachers for their children, and our goal is to help coach them in that way so that they can do that. Our last little tiny program that's just so important though is our adaptive mobility equipment loan closet. We've expanded that from what some people know us for, but we have, this is the time of year because it's melting. Yay! But knee walkers and scooters and wheelchairs and crutches and all of those things that people might need in order to get around. We also have adaptive mobility equipment for our younger kiddos. So we do have children's-sized wheelchairs. We do have walkers for smaller kiddos. So sometimes those smaller people, it's harder to find those things for them, and we have them.
Is that a self-referral or do they need a
loan closet?
Yeah.
Just give us a call if we have it. We will loan it to you. It's we have a $10 cleaning fee, and then the fee for the equipment is refundable when it's returned. It's very expensive. We have a list on our website of the equipment that's available to anyone, and then if there's smaller things, little things, you can just give us a call. Yeah, it's a very accessible program. I think I tried to cover all of this in my overview. So let's see. Yes, so referrals can come from anyone at any time. You do not have to be a pediatrician, although we do love our pediatricians to refer, even if you don't think they have a 50% delay in putting in the plug. We oftentimes can qualify kiddos in infant learning program or in one of our other programs in a unique way through a specific diagnosis or qualifying condition. So if there is a question, we always ask for that referral. You do not have to be a medical provider, though. We have caregivers and childcare and grandmas and aunties and all the people that make those referrals. So then the parents, caregivers get to make that decision on whether they enroll. So that's ACCA, and I hope I went quick enough. So.
I was, as Trevor mentioned, the email chain, like when something happens, like you're gonna get like 5 emails. When something big happens in ILP, I get an email from Heidi, and I feel like all of our teams like will make something, and someone's like, I got 6 super big emails about ILP stuff, and it all started from Heidi. I was like, yes, that's how we all respond, because I get it from Teresa and she gets mine, and so we all just, or from Kayla, we all just shoot it out to each other, and then we have people call in and advocate and share their stories. So do that more, everybody, as you get those emails from us, because we need to share. And speaking of really exciting things, we've got Meredith from the executive director, who's the executive director of the Fairbanks Children's Museum.
And I only have 3 slides, so we'll.
Yeah, but you gotta make news.
Into mine, I just wanted to share, my son got services at ACCA and it completely changed our lives. He is deaf in one ear and has microtia, and for whatever reason, since he's only deaf in one ear and needed a bone conduction hearing aid, insurance wouldn't cover it, Medicaid wouldn't cover it. So ACCA connected us with a group in Idaho where they're really selling you reconstructive surgery, but maybe you can they'll cover your hearing aid. And then we're working on that, and then but they didn't stop behind the scenes, found a family that had a bone conduction hearing aid before, got the hearing aid from them because they didn't use it anymore, gave it to us. It's a $6,000 piece of equipment that we got for free. And it did then eventually break, and then we had to buy one out of pocket. And now he has switched to a traditional hearing aid, which is covered. So now I get to bring you guys another one. Yay. That was a wonderful story. Okay, Children's Museum. So our current location is in the historic Woolworths building at 302 Cushman. But now we have a future location, which is in City Hall in the former Boys and Girls Club space. It's just up the block. It is double the square footage. Our rent at our current location is $11,000 a month. So all of the hustling that we do, a huge portion of that goes to rent. Our rent at our double the square footage space will be $4,000 a month. We are going to be partnering with the Wellness Coalition over there, and they're going to work to fill some of the gaps that the Boys and Girls Club has left. We're going to be taking them on as we'll be their fiscal sponsor, but they're essentially going to become a program of the museum. And then we're also opening an early learning center. It'll be a childcare center for kids aged 3 to 5, and we're going to have 40 spots. So that should be within the next year that will open. And then the museum will move over the course of the next 4 years. We still have 4 years on our lease. We are going to launch a capital campaign and then build out the space. So we've got many years of work to do, and we'll continue offering services where we are that whole time. Our attendance is 50,000 people a year, which is a ton in a community this size. 20% of those come for free, 20% pay reduced admission, 20% pay full price. The remaining 40% are members. So they pay one time a year, and then they come as much as they want all year long. Our outreach, we reach about 20,000 more than we see in person, and that's going to the Southside Farmers Market, but it's also been TCC sent us to Huslia and to Ruby, and in an ECM meeting, I shared this, and people immediately were like, well, could you come to our community? And then within the next 6 months, we went to Dillingham, Manicottic, we went to Nome. Yeah. We're about to go down to Soldotna. I have a McGrath one in the works, and essentially, if you can pay to get us there, I can pay my staff and I can bring the stuff, but I can't pay for flights. So Jeannie and Dillingham just hosted us, and she hopes to bring us back next year for Beaver Roundup, and I won't get to go again. I'll have to send somebody else to my place, and that makes me very sad. So our budget, I only have it on here to show the growth. So in 2019, last year before the pandemic, it was our best year to date since we opened. Our annual budget was $470,000. Last year, we ended with $850,000 in expenses. It's mostly people, as everywhere. Personnel is the largest line item, but that's because we are doing so much. So if I can ask everybody one thing that I share that we're doing that you didn't know, tell 3 people about it when you leave, because we do so much, and there's a lot of, I don't think the community knows. I don't think generally speaking, people know how much we're doing. So our programs, the interactive play-based exhibits is the museum itself. So that's our primary program. But then we also have daily pre-K programming that is either art, science, or music-based every single day. We have parent support groups. We provide a space for foster care visitation. ACCA does visits there, meets with clients there. RCPC does as well. Baby Cafe happens at the museum. We just provide the space for free for the Breastfeeding Coalition to meet moms or have parents come there and get their way in. And all of my staff that have had babies since Baby Cafe has been there, they all use the program too. It's just such a safe, easy place to do stressful things. And it's mutually beneficial because then they learn about the museum as new parents. school age programming, we do workshops, we have classes. I listed homeschool support mostly because like if a homeschool community realizes they're really struggling to meet art requirements, they can reach out to us and we'll put on an art class that meets education standards. We also have drop-off programming. We do summer camps. We have camps whenever the school district is on break. And then we also recently started, it's not recent anymore, we do pre-camp, which is a drop-off program for kids that have never been away from their parents. They've never been to daycare, they've never been to a preschool, and they're about to start kindergarten. The museum's already safe, they already know our staff, so it's a really safe, comfortable way for a parent to try out leaving the kid behind for 2 hours, maybe 3 hours. We just had that today, they sell out every week. It's a great program. So our big thing that we're constantly pushing and harping on is that it's not just play. It's more than just play. We're preventing adverse childhood experiences. We're providing positive childhood experiences. We're supporting isolated parents. Everybody knows that's a huge problem here. We are oftentimes, especially those families that don't have access to childcare or some other ACCA service or any other early ed, we might be their only early ed resource that they have until they hit the public school system. And we know in the Children's Museum world, the Association of Children's Museums just published last year a document for all of us to use in our grant writing, where they collected the data on the long-term impacts of having access to a children's museum in your community. And it's higher graduation rates, it's lower occurrences of mental illness into adulthood, it's better financial stability in adulthood. There is a correlation. And I mean, we probably could actually look at that data across the state because we were the only one for so long. And now Seward has one. And I would be willing to bet that they're going to see better kindergarten readiness now. So it's more than just play, it's prevention and education through play, and identifying us as an education resource and recognizing that we are in the world of prevention, spreading that message and making that known, and it increases our ability to access funding in a really profound way. So we talk about it a lot. I write grants out the wazoo, hoping that somebody will believe me. They usually don't, so we just keep saying it, and the more they hear me say it, the more they'll believe it. So that's my spiel. We do, all of my staff does amazing things, so thanks for listening.
Meredith or the Children's Museum. It's so cool. The minute she said, "Oh yeah, we can come to your communities," everyone's like, "What?" Like whipped around their chairs, and she's like, "Whoa!" Like, "You really come to Dillingham and really go to Kodiak and really go to Minnesota?" And she's like, "Yes." And so the opportunity for so many like incredible memories and opportunities is just so filled with such positive intent and great learning and community building. It's just amazing. So thank you for all that you're doing and that your staff are doing. And that's great language for us to be able to be like, oh yeah, they are helping prevent ACEs. And so as we, you have a great group over here who like knows all that stuff too. And so helping us be able to advocate for you guys more. So we have a ton of Help Me Grow stuff over there. We don't want to fly home with it. It's all free for you to order anyway. And Trevor's going to take some because they have a cool event happening tonight that you all mentioned. Our season finale partnership meeting is going to be in Unalaska on May 1st, which is very exciting. So if you want to come along, hop on the plane with us. If not, you can,
Grab for lunch.
I hope so. And before you leave, we want to take a group picture. I wonder if Brittany's out there. Perfect. If you guys want to come up here, we'll just, if you want to be in the picture, if not, no pressure. Hi, Brittany. Would you like to take our picture, please?
I'm like, who's calling me?
Okay. Everybody, come on up. We'll